Hi guys, from Team Nurses Handbook. Here I am to share with you some multiple choice questions for your upcoming nursing preparatory exams. Today I have brought the questions from the subject Gynecological and Obstetrical Nursing. Question number 1. Nerve supply to the vulva is through option 1 genitofemoral nerve, option 2 pudendal nerve, option 3 ilo-inguinal nerve, and option 4 all of the above. And the correct answer is all of the above. Vulva refers to the external female genitalia. It is a collective term for several anatomical structures, and the structures are mons pubis, labia majora, labia minora, vestibule, Bartholin's glands, and clitoris. Parasympathetic nerves, that is the pudendal nerves, supplies the vagina and the pelvic outlet, and there is a minor supply from the genitofemoral nerve and the perineal branch of the posterior femoral nerve. Question number 2. Placenta secretes all the following hormones except option 1 human chorionic gonadotrophin, option 2 progesterone, option 3 estrogen, and option 4 luteinizing hormone. And the correct answer is option 4 luteinizing hormone. Placenta is a temporary endocrine organ that connects the developing fetus to the wall of the mother's uterus during pregnancy. Placenta is formed by cells that originate from the fetus and is therefore the first of the fetal organs to develop. Placenta produces two steroid hormones, that is progesterone and estrogen, and releases several protein hormones, that is human chorionic gonadotrophin, human placental lactogen, placental growth hormone, relaxin, and kisspeptin. Question number 3. Daughter cells formed after meiosis 1 contain dash chromosomes. Option 1 haploid, option 2 diploid, option 3 aneuploid, and option 4 polyploid. And the correct answer is option 1 haploid. Meiosis is a type of cell division that reduces the number of chromosomes in the parent cell by half and produces 4 gamete cells. So, in meiosis we have different stages, which is called prophase, metaphase, anaphase, and telophase. During meiosis, each of these phases occur twice. Once during the first round of division, which is called meiosis 1, and it takes place again during the second round of division, which is called meiosis 2. And in meiosis 1, what happens is the original cell divides into two daughter cells, and each has only one set of chromosome, that is haploid chromosomes. Question number 4. After menopause, increased facial hair growth and change in voice occur due to option 1 fall in FSH level, option 2 decreased androgen level, option 3 increase in FSH level, and option 4 increase in androgen level. And the correct answer is option 4 increase in androgen level. Menopause is the end of a woman's menstrual cycle, and during menopause there will be lowered production of estrogen and progesterone. But in some women's, androgen production will be more, and that is what which leads to excessive hair growth on face and voice changes in the female. Question number 5. Number of bones in female pelvis is option 1 3, option 2 2, option 3 4, and option 4 1. And the correct answer is option 1 3. Question number 6. In the fetal skull, the bregma is found. Option 1 between the frontal and parietal bone, option 2 at the junction of sagittal, coronal, and frontal suture, option 3 between the two halves of the frontal bones, and option 4 at the junction of lambdoidal and sagittal suture. And the correct answer is option 2 at the junction of sagittal, coronal, and frontal suture. Bregma is the midline bony landmark where the coronal and sagittal sutures meet, that is between the frontal and two parietal bones, or we say at the junction. It is also known as anterior fontanelle in the neonates, and it closes after 18 months of birth. Question number 7. Positive definite sign of pregnancy is Option 1, visualization of fetus by ultrasound. Option 2, uterine enlargement. Option 3, amenorrhea. Option 4, quickening. And the correct answer is option 1, that is visualization of fetus by ultrasound. Positive signs of pregnancy are those signs that are definitely confirmed as pregnancy. Positive means conclusive, definite or absolute. They include fetal heart sounds, ultrasound scanning of the fetus, palpation of the entire fetus, palpation of fetal movements, and delivery of the baby. Question number 8. After determining that a pregnant client is Rh negative, gynecologist orders an indirect COMPRISES test. What is the purpose of performing this test in a pregnant client? Option 1, to determine the fetal blood Rh factor. Option 2, to determine the maternal blood Rh factor. Option 3, to detect maternal antibodies against fetal Rh negative factor. And option 4, to detect maternal antibodies against fetal Rh positive factor. And the correct answer is option 4, that is to detect maternal antibodies against fetal Rh positive factor. An indirect COMPRISES test can be used to determine whether there are antibodies to the Rh factor in the mother's blood. A negative result means that the mother has not developed antibodies against the fetus blood and the fetus is safe. Whereas a positive result means that the mother has developed antibodies to the fetal red blood cells and is sensitized, and chances of fetal harm is also there. Question number 9. Which sign is considered as welcome sign in pregnancy? Option number 1, lightning. Option number 2, show. Option number 3, onset of labor pain. And option number 4, quickening. And the correct answer is option number 1, lightning. At the end of the third trimester, the baby settles or drops lower into the mother's pelvis. And it is one of the signs that the mother is getting closer to labor. Dropping or lightning occurs 2 to 4 weeks before delivery. And the 8 signs of baby dropping or lightning are: first, a lower belly position; second, a mother can eat easier; third, better breathing; fourth, increased need to urinate; fifth, pelvic pain; sixth is changes in gait; seventh is back pain; and eighth is hemorrhoids. As more pressure on the veins of the rectum occurs, this leads to development of hemorrhoids in the patient. Question number 10. The classical method used in bringing down an arm in breech presentation is called: Option 1, Röntgen's maneuver. Option 2, Lovset's maneuver. Option 3, Krebs's maneuver. And option 4, Pinard's maneuver. And the correct answer is option 2, Lovset's maneuver. Lovset's maneuver is the rotation of the trunk of the fetus during a breech birth to facilitate delivery of the arms and the shoulders. Now let us see the steps in it. First is, keep both the thumbs on the infant's sacrum, taking hold of the hips and pelvis with the other fingers. Then turn the infant's back 90 degrees, that is left or to the right, so that the anterior shoulder comes underneath the symphysis, engaged, then deliver the arm. Next is, after this, a 180 degree counter rotation to the left or right is done, which engages the posterior arm, then that is delivered. Thank you for watching. For more updates like this, do like, share and subscribe to our channel Nurses Handbook.